Hey, my name is Jim Hefner. I'm a doctor of physical therapy and an orthopedic clinical specialist, and I've been treating neck pain and shoulder pain for over a decade now. I've had a lot of pillow talk with people when it comes to what type of pillow someone should be using when they're having neck pain or shoulder pain. And before we even get into that, the biggest thing I want you to think about is if you go on vacation and you use a different pillow for one night and you have neck pain, that likely means there's some underlying factor that we're not addressing. If your neck can't tolerate a difference of position for 6 or 8 hours because you sleep with a different pillow, there's likely some underlying stiffness or an underlying strength problem that is sort of feeding into your neck. Because if a small adjustment like that triggers pain, that means you don't have very much resiliency around what your neck can handle. But with that said, we often get comfortable with what we use and what we have, and we often don't have a ton of windows of resiliency around what triggers our pain. So I want to talk about what type of pillow you should use and um, where I would start with this is choosing the right pillow is kind of like choosing the right pair of shoes. When you go into the store, there's going to be a salesman who's going to sell you on the comfort of it or the color of it or something fancy. But really, what matters is you need to find something that works for you, and it's likely something that you've used before and that your body is comfortable with. Um, Choosing the right pillow is very individual to the person. So I can't say that this pillow is good for this neck type and this pillow is good for somebody else. As a general rule, though, what I would say is when you're having pain, we need to take pressure off of our tissues. And if you're putting yourself, if my pillow is right here and the pillow is dropping my neck down, so it's curving my neck into a smaller angle, that's going to put a lot of pressure on that side and a stretch on this side. If I have too much pillow where it's pushing me up that way, so if there's two pillows stacked up, that's putting a big stretch across there and then compressing the opposite side. What we want is this is my pillow and it's pretty soft and comfortable, but as I put my head under there, the pressure stays fairly in line. So as I am lying down on my side, there's not a huge amount of pressure there, or it's not pushing me away that way. Let's go back to what I said at the beginning. If one night of pain, if you have a neck pain or a crick in your neck from one night of using the wrong pillow, then there might be some underlying things. But if you're having pain and you're wondering about should I change my pillow? Well, if it's waking you up at night, if it's clearly contributing some sort of something where we need to shake it up at night to try to disrupt the pain cycle, then addressing those things where the pillow should sneak up right into your shoulder into that groove there, and it should maximize or hold that space without dropping down or pushing up. So in review, choosing a pillow is like choosing a pair of shoes. It's going to be very individual to the right person. If you're having pain and that pain is waking you up at night, or if that pain seems to be associated with your sleeping habits, then I would definitely try a new pillow type and search for one that gives you the comfort in that space. It shouldn't crick you one way or drop you the other way.